Okay, good afternoon. My presentation topic is therapeutic penetrating keratoplasty in pre-COVID and COVID period. According to the national survey done in 2015 to 2019, corneal blindness was the major cause of visual impairment in India, and infectious keratitis was the primary etiology of it. And therapeutic penetrating keratoplasty was done for majority of these cases, which was an emergency procedure. COVID-19, as we have all been through it 5 years back, we are all aware about the impacts it has made in every sectors of our lives. It has also impacted eye banking and corneal transplantation practices. It has exacerbated pre-existing issues in eye banking, such as decreased donor cornea availability and logistical challenges, and which required urgent adaptation to new protocols. Our study population, in our study, we included patients aged 14 years and or above who underwent TPK due to perforated corneal ulcers, non-healing ulcers, or ulcers involving the limbal or scleral areas. Our study duration was divided into pre-COVID period and COVID period. Pre-COVID period lasted for 7 months from August 2019 to March 2020. And COVID period lasted for 24 months from April 2020 to March 2022, and it was a retrospective hospital-based comparative study. In a total of 121 TPKs were performed during this study, 30 during pre-COVID and 91 during COVID period. There were no significant differences seen in age and gender. And as we can see in this table, the most common indication for TPK was non-healing corneal ulcer followed by perforation. So this table and the bar diagram shows the donor cornea characteristics. In this first bar diagram, we can see that the uses of MK media, which is the short-term storage media, decreased during COVID period, and cornical and glycerol media, that is the intermediate and long-term storage media respectively, it increased significantly during the COVID period. And during the COVID period, the retrieving the cornea increased even after 12 hours of the death. However, there were no significant changes seen in the endothelial cell count between the two periods, but donor corneal sloughing was seen mostly in the COVID period due to increase in death to preservation time. Now, coming to the treatment outcome post TPK, we defined therapeutic success as the cornea which maintain the anatomical integrity and also which remove the infectious process, and functional outcome as a clear graft or vision with vision more than 660. In both the period, the therapeutic and the functional outcome was similar. Now, to conclude, I want to focus on 3 main points: that as changes were made in the policies of eye banking, such as retrieving the donor cornea even after 12 hours of death, and uses of intermediate and long-term donor cornea preservation technique, we could overcome the challenges of severe shortage of donor cornea. This study concluded that despite operational challenges during COVID-19 pandemic, donor cornea quality and treatment outcomes for TPK remain largely unchanged, and there is a recommendation for practice to include continued monitoring of eye banking policies, enhancing public awareness regarding corneal donation, and pursuing research into innovative practices that can withstand future challenges.